Hello everyone, myself Simran Paroche, student of Dr. Hari Singh Gaur Central University, Sagar, Madhya Pradesh. Today we are going to study about the skull of rabbit. The skull of rabbit is dicondylic, that means each exo-occipital bears an occipital condyle to articulate with the atlas vertebra, as well as skull is tropibasic, that is vertical interorbital septum lies between two orbits so that the cranium doesn't extend forward into the orbital region. The orbits are situated just behind the junction of the cranial and facial region and quite large. Skull of rabbit has two parts. First one is posterior cranial part, which is shorter and fairly well developed, and second one is anterior facial part. It is longer, deflected at an angle of about 60 degree and comprises mainly the jaw. The skull of rabbit consists of cranium, sense capsule, upper jaw, lower jaw and hyoid apparatus. First, we are talking about the cranial part. It is the part of skull where the brain is protected and it is also known as brain box. It is divisible into three major regions. First one is occipital region, second parietal region and the last frontal region. First of all, the occipital region. It is the region on the posterior side of the cranium. There is a wide opening named foramen magnum, through which the brain emerges out as a spinal nerve cord. On the back side of the occipital region, there are two knob-like structures, occipital condyle, which articulate with the first vertebra, atlas. Occipital condyle are partly formed from the basio-occipital and exo-occipital bones. The supraoccipital forms the two sides of foramen magnum and the basio-occipital forms the floor. The second one is parietal region. In front of the occipital region, the parietal region of the cranium is present. It has ventral basiphonoid, dorsal to parietal, and the lateral to allocephenoid. Squamosal bone separated by the occipital and parietal region laterally. In between the dorsal bones, the supraoccipital and parietal, a small bone interparietal is present. Third one, frontal region. Anterior part of the cranium is frontal region. It consists of 6 bones, 2 dorsal frontals, 1 ventral basiphonoid, 2 lateral orbitophysinoids. Anterior margin of cranial cavity is closed by a vertical bone cribriform plate. Now the sensory capsules. Skull of rabbit has 3 types of sensory capsules: olfactory capsule, optic capsule and the auditory capsule. Now the first one, olfactory capsule. A pair of olfactory capsule is present in front of the frontal region of the cranium. They are dorsally covered by a pair of nasals. Optic capsules. There are 2 large sockets on the side of the frontal segment of the cranium. The third one, auditory capsule. These are present at the junction of the occipital and parietal region of the cranium. Now, the hyoid apparatus. It is situated between the 2 rami of dentary bones. It forms the posterior part of the buccal cavity floor. Now the lower jaw. The lower jaw consists of 2 rami which are joined by symphysis anteriorly. In the last, upper jaw. It consists of 2 halves: premaxilla, maxilla, jewel, palatine, pterygoid, squamosal. First of all, premaxilla. Each premaxilla bears 2 sockets for the upper incisor teeth. Second, maxilla. Maxilla present at posterior to the premaxilla and it bears premolar and molars. Third, jugal. Jugal is compressed bone which forms the middle part of the zygomatic arc. Fourth, pterygoid. Pterygoid is a thin bone situated behind the palatine. Now the last one, squamosal. Squamosal lies on lateral side of the cranium. It gives off zygomatic and post-tympanic processes. That's all about the skull of rabbit. Now in the end, I would like to thank my teacher, Dr. Dipali Jat ma'am, for her support and guidance. Thank you so much.